Welcome to the PA Insights podcast, powered by NCCPA. In this episode, we're joined once again by Andrzej Kozakowski, Mirella Bruza, Colette Jeffrey, and Casey Puckett, the NCCPA research team, this time to break down their latest state report. It's an in-depth look at how PAs are practicing and distributed across the United States, from workforce growth and telemedicine adoption to retirement trends, income disparities, and leadership roles. This report offers valuable insight into how the PA profession continues to evolve. If you want to understand where the PA workforce stands today and where it's headed in the future, this conversation is packed with data and perspective you won't want to miss. So let's dive in. All right, very welcome to have back on the podcast the amazing, incredible, outstanding NCCPA research team. Thanks so much for joining us again today.
Thank you
Glad to
for
be here.
having us.
So let's get into this new state report that came out. I think probably the best place for us to start is just for any listeners who may not be familiar with the report. What is it and why does NCCPA produce it every single year?
So that's a great question. The state report is an important resource for many stakeholders. So for policymakers, workforce planners, Ps, it provides a very detailed look at how Ps are distributed and practicing across all 50 US states, as well as Washington, D.C. One of the key strengths of this report is its state level focus, which really highlights how adaptable the PA workforce is to different healthcare environments. It also shows how PAs are responding to specific needs for their communities, whether that's through telemedicine, working in rural practices, or serving in health professional shortage areas and medically underserved areas. So, overall, the report provides a detailed picture of the profession's growth, practice patterns, and the important role PAs play in meeting healthcare needs across the country.
So I'm curious, where does the data in this report specifically come from?
Our main source for this data is the PA Professional Profile, which is a secure online data collection tool that we first launched way back in May of 2012. Critically important is that this report would not be possible without the participation of the PA community. By the end of 2024, more than 159,000 PAs had provided or updated their information in our professional profile. So we're deeply grateful to all PAs who contribute to this data source. We also use data from the Federation of State Medical Boards, which provides the total number of PA licenses across the US, including counts for every state and Washington, D.C. as well.
So, what does this year's report reveal about how PAs are distributed across states here in the United States?
When we look at where board certified PAs practice, the largest numbers are in New York, California, Florida, Texas, and Pennsylvania. But if you adjust for population, the states with the highest PA density are Alaska, Pennsylvania, Connecticut, North Carolina, and Montana. In terms of recent growth, South Carolina, Hawaii, and Arkansas saw the biggest increases in PAs between 2020 and 2024. PAs also report high levels of care in health professional shortage areas and medically underserved areas, particularly in New Mexico and Alaska, as well as Montana. And rural practice is most common in Wyoming, Montana, and Vermont. And several states have a strong concentration of PAs in primary care, especially in Alaska, North Dakota, and Wyoming.
So, the report also highlights retirement intentions of PAs. I'm curious what trends you guys are also seeing in regards to that.
So, nationally, about 5.8% of PAs say they plan to retire within the next 5 years. And interestingly, that number has not changed since about 2020 from our 2020 data and that specific report. So, at the national level, things are pretty stable. But when you zoom in by state, there are some differences. So, Wyoming has the highest percentage with about 14.3% of PAs planning to retire, followed closely by Alaska at 14.2%. Then you have North Dakota at 12.9%, Vermont at 11.8%, and New Mexico at 10.7%. Looking at how things have shifted since 2020, Vermont actually saw the biggest increase in PAs planning to retire, so rising by about 3.3%. Washington, D.C. was next, up 2.9%, and Alaska increased by about 1.9%. On the other hand, some states saw fewer PAs planning to retire. Maine had the biggest drop with 2.2% fewer PAs saying they plan to retire compared to 2020. That was followed by Hawaii down by 1.8%, Delaware down by 1.4%.
So, another headline from this report involves income disparities, specifically around gender.
So, overall, in the United States, male PAs working 40 or more hours per week earn on average $17,177 more than female PAs. The three states that we saw with the largest mean differences in male to female income for PAs working 40 or more hours per week are Louisiana at $22,866, followed by Alabama with $21,471, and then South Carolina with $21,424 as the mean difference.
So, the report also notes continued telemedicine utilization. How significant is that trend now compared to where we were at pre pandemic levels?
So, we've definitely seen a significant change in telemedicine use from pre COVID to now. In 2020, our telemedicine participation for PAs was 20.7% in the United States. And now in 2024, we see 43.5%. And this shows a 22.8% increase from 2020 to 2024. And the three states with the highest telemedicine participation include Alaska at 64.1%, Oregon at 58.2%, and California at 56.6%.
So, what does the data show when it comes to PAs serving in leadership roles or as preceptors?
I'm glad you asked that, Jesse. And actually, PAs in leadership question is one of our newer questions. As the PA population is growing, we're noticing that more PAs are interested in leadership. So we wanted to capture that in the PA professional profile. We noticed that nearly about 17% of PAs hold a leadership position within their principal employment. And of those, majority of them reported that they hold a leadership position in clinical setting, followed by PAs that hold a position in administration, education, research, or other roles. Interestingly, about a third of those PAs that hold a leadership position, they also reported that they hold a leadership position outside of their employment. And some of the factors they mentioned were that they hold those positions as board members on professional organization or chair or leads in committees within their institution. So it looks like there is a growing demand for PAs to participate on those leadership. And you also asked about precepting, and that was also pretty interesting data that we found because about 38% of the PAs in the United States, they actually are precepting students. And they spend on average about 4 hours per week precepting students, but it doesn't only include PA students, it includes medical student, other healthcare professional students. And the areas or the states that we see the most participation actually, which is interesting, it's Connecticut and New York, which they are about 52 to 50% of the PAs reporting. And it could potentially be due to the fact that the Northeast has the more PA program and is more dense, but it shows that PAs are continuously participating in PA education. So that's probably a ground for more research in the future to kind of dig a little bit more.
It's really interesting. The report also touches on PAs participating in international medical work. I'm curious if there were any things that stood out to you guys in regards to that subject matter.
That's actually also one of our newer question in the profile. And the reason for that is kind of to explore the portion of PAs that participated in international work. We actually found that about 11% of PAs participated in international work. And this was particularly if they were either volunteering or if they were paid activities. Among those PAs that stated that they participated in international work, a higher proportion was seen in states such as Alaska and Hawaii, which it's not entirely surprising because those states are geographically in proximity with a lot of international region. So those are some of the interesting things that we found, and we hope that we can explore that information further in the future.
So let's zoom out a little bit, talk a little bit big picture. I'm very curious if what to you guys was the most important takeaway from this year's report, or was there anything that surprised you that really jumped out from the data?
Well, as far as being surprised, we've been monitoring the data pretty closely since 2012, and so you see little increases. But this year was a big year of growth between 2020 and 2024. In the report, we look at 5-year periods of time to see if we see a lot of changes. And between that time period, the workforce grew about 28%. And this isn't very surprising to us because we also know from our PA who accredited the PA programs that there in 2020 there were 250 accredited PA programs, and today there are 322 accredited programs. So more programs usually equal more graduates and more certified PAs down the road. But we were kind of surprised because states like South Carolina saw almost a 50% increase in the number of PAs in that same 5-year period, and they were the highest for that time period.
What should listeners expect from the PA workforce over the next 5, even 10 years into the future?
From us monitoring the data, I think we should expect to see that the PA workforce is continuing to grow. It's still a relatively young profession. We still have programs that are growing. So I said today there's 322 accredited programs. In the next 5 years, our PA is expecting that to increase to 363 programs. So we do expect more continuing to enter the workforce. We don't see any signs of slowdown in the workforce. We also anticipate more recruiting and hiring of PAs. There's a question that we ask if the PAs in the PA professional profile, if their place of employment is currently hiring and recruiting PAs. And in 2024, about 44% said that their current employer was actively recruiting PAs. And in 2020, about 30% said that their employer was actively recruiting. So more PAs coming into the scene definitely makes for more active recruiting of the PAs. The states with the highest percentages of active recruiting include DC, Connecticut, and Maine. And in 14 states, more than 50% of practicing PAs indicated that their employer was actively hiring PAs.
That's exciting news. Thank you so much for joining us this week on the PA Insights podcast. Before we go, for any listeners who may want to dive deeper into this report and into all the research that you guys have done, where can they find this information online?
The best place to find this report and all of our reports going back to 2013 is our website. So if you search NCCPA research on Google, that's the easiest way to find it. And you can peruse all the reports that we have, as well as other research studies, peer-reviewed publications, and even posters. So highly recommend check out all the wonderful data and research studies that we have available on our site.
Thanks again for listening to this episode of the PA Insights podcast. We want to issue a big thank you to the NCCPA research team for joining us and sharing insights from the latest state report. Their work helps paint a clear picture of the PA profession, highlighting workforce growth, practice trends, and many ways PAs are helping meet healthcare needs across the country. If you'd like to explore the full report or learn more about NCCPA's research, you can find the state report and many other publications by searching NCCPA Research online. And if you enjoyed today's episode, be sure to subscribe, share it with a colleague, and stay tuned for more conversations about the future of the PA profession. Until next time, thanks for listening.